Joshua, I'm looking at the calendar. And you know, in the Midwest and the South, high school football starts literally in 10 days. The seniors come back for sports, and they start early school. Would you let schools open right now with what you know about the virus?
I'd be pretty reluctant to do that in areas where there's a high amount of spread, and I'd be especially reluctant to doing high school football, which really requires a tremendous amount of contact, obviously, and has been shown with all these colleges to be a place where virus gets transmitted.
I mean, it's an extraordinary moment for the country. It's July 27. In 10 days, it's going to be more urgent for the East Coast as well. How do the masks work in a school when the kids are trotting around the hallways?
Well, I think part of the idea for schools is to reduce the amount of trotting around in the hallways. For younger kids, you keep the kids in a class. For older kids, you might move the teachers in between classes, but really, it really shouldn't look anything like it did last year in terms of crowded hallways.
Joshua, but this could be, and this is, of course, you know, what governments have to choose around the world is public health, you know, compared to the people that, you know, can't have an education at home and the benefits that actually being in a classroom from students are. Who's the best person to choose these kind of, you know, difficult lines between the economy and public health, between, you know, saving lives, but also not letting people starve or go uneducated?
Well, you know, what we did was we sort of consciously picked the economy, and it's collapsed. You know, that the whole approach has not worked. It's really important to follow the path that so many other countries have done, where you really take care of the virus. You spend money to keep people fed and housed. You don't let evictions happen, and you beat back the virus first, and then that allows you to have more of an economy. People who are jumping to, like, let's have the economy are now finding out that the consequence is an enormous amount of viral transmission. So I think it was a bit of a false choice back then, as it is now. And, you know, one other thing to note, individually, people are pretty risk averse, right? People are afraid to do things because they're worried about the virus. But socially, we've been kind of reckless in a lot of places. We've been, you know, opening bars, you know, encouraging people not to wear masks, telling people this is all behind them, it'll go away. And so we need to line up our social policies with the individual risk aversion that we feel. If we want to protect schools, if we want to protect nursing homes, other places, we have to do that together, not just one at a time.
Does the message to people have to be that we could have to do this for the next 2 years? Were people quickly to dismiss that actually, you know, we've gotten over the worst and then the virus was under control?
You know, back in the spring, the path was pretty clear. Really be vigilant, drive down the cases, slowly open up with public health capacity to do contact tracing. And containment, and focusing on the highest risk areas and some of the underlying issues causing infection. We didn't do that then, but we can have a do-over. The do-over doesn't mean you shut down for 9 months. The do-over means you shut down long enough to really drive the cases down, and then you're vigilant, you slowly open, and you have the public health capacity.
Joshua, you came out of the Boston Children's Hospital Combine in Harvard. You wandered down to Washington with Henry Waxman, and you did a lot of work overseeing the FDA. You've got a real political savvy from the medical side. What do you want from the politicians right now?
I think much more of a sense of responsibility from the top. I mean, I think that the characteristic of the White House and the administration has been, this is not our problem, this is the problem of the states. And we heard that over the weekend. It's enormously frustrating. I think one of the most important roles for leadership is to take responsibility and to help illuminate a path. You don't have to dictate every decision, but illuminate a path forward instead of just saying, you know, this is really your problem and good luck with that. And I think that is going to be seen as one of the major failures of leadership right now.